What a nice shirt you're wearing. Hi, my name is Katrina McClure, and I'm the Executive Director of Sinclair Health Clinic. We have been a clinic since 1986 with our humble beginnings in the basement of a church. And we have been serving patients ever since. So I'm going to give you a quick tour of our clinic, so let's go head on in. Hi, I'm glad you could make it inside. So our setup's a little different right now because we are screening all of our patients for coronavirus, and we just want to make sure it's safe, but it doesn't quite look the same as it does on a normal day. So here is our front reception windows, and this is actually going to be moved to pharmacy in the upcoming months. So we're all about change and improvement and moving forward. So Sinclair Health Clinic, we focus on people who don't have insurance, but we also expanded to Medicaid because we found that a lot of people who have Medicaid coverage, they weren't able to actually get care right off the bat. The communities can take them a little more time to be able to absorb this huge number of patients. So we had to keep doing our mission, and so we serve some Medicaid types as well. So we offer a wide range of services. We have an integrative primary care model, so we can take care of all those chronic diseases, the diabetes, the HIV management. We treat and cure hepatitis C. We do sick visits. We do GYN exams. We do early prenatal care. I mean, any of your primary care needs, we've got them covered. So we also offer pharmacy services. We have a pharmacy on site, and I look forward to showing you that. And it provides low-cost medications to all of our patients and to the community at large. So not a lot of people know that our pharmacy is open to everyone, but it actually makes a huge difference for a lot of people when they find that their insurance, even using their insurance, is still unaffordable with the medications. But we do, our pharmacy is open to the public, we just don't charge insurance. We also have on-site mental health services, including a psychiatric nurse practitioner who can prescribe medications. This is incredibly important for people with bipolar disorders, schizophrenia, and other really devastating mood disorders and psychiatric illness. So we can help them here on site. We also have a full-time licensed professional counselor to help people with more holistically with their mental health needs, because the evidence shows that that's the most effective way to get people back on the road and moving on their path. We're gonna go head up to pharmacy now. So we're gonna run up the stairs, and I'll see you there in a bit. Hi, so welcome to our clinic's lobby. So you'll notice that we have really nice art on the walls. We have soothing landscapes. We have a lot of nature in this space. And it's to create a sense of calm and relaxation for our patients. So this becomes a more healing and, emotionally well place. We also, it's a little different than usual, again, because of COVID-19. So all of our chairs are 6 feet apart, and we do that just for patient safety. But usually, way more chairs. So here's the front desk area where patients check in for their appointments, get new patient appointments, put in their paperwork or what have you. So they check in here. Now it's closed right now because I don't want patients in the shot to protect their privacy. So thanks for bearing with me and using your imagination. Normally, there's very happy, smiling faces ready and able to greet our patients. Both of our reception staff are bilingual to help our English and Spanish speakers. So let's go ahead and head into the clinic. Come on in. So this is where patients enter and they get their weights done and their height, so we can do their BMI, and we also do blood pressures in the exam rooms themselves. So come on this way. So this is our clinic hall. We have 9 different exam rooms, and we have 1 procedure room. some mild procedures here. So in here is what the exam room looks like. It's pretty typical. We have a bed, we have some soothing artwork, we have condoms. We encourage patients to fill their pockets, and that's with partnership with ARE, Sync medical equipment. And we do have exam beds with, you know, the disposable paper that we put on for every patient. But this is where most of the high quality work is delivered. All right, so I'm going to take you over to our counselor's office. He is fabulous. We're excited to have him. He really does great work for our patients. So this is his office here. Again, it's very soothing space because that's what our patients deserve. Some good lighting, fun things to squeeze and press. And he helps people with all sorts of challenges, emotional challenges that they're going through, as well as offering counseling support for people that are suffering from more severe mental illnesses. So we'll head on over. So again, we do have a large number of exam rooms. We do have a bathroom, and we do take urine samples and do tests on urine. So more exam rooms. I'll lead you over to our psychiatric nurse practitioner's office. She's right here. And again, it's a little homier in this room than the more, you know, clean, sterile environment of our clinical space. There's a carpet. There's a couch. It's supposed to be more soothing, more comforting, without the clinical vibe. All right, I'm going to take you on to another room. It's where our occupational therapy and music therapy takes place, and this is with partnership with Shenandoah University. So you'll see there's some instruments from one of their sessions, but we are very lucky to have an amazing relationship with Shenandoah University. Professors come out and they teach students while offering really high quality services to our patients. We have physical therapy that comes out. They work downstairs. We have music therapy. We're actually a space for somebody doing research around the therapeutic merits of songwriting with the homeless population. And we also have occupational therapy that does a lot of the mental health work as well. So we're very lucky to have such strong partners within Shenandoah to have even more services. On top of that, we have clinical pharmacists that help with our complex patients, especially with all the tons of medications that they have to take, and making sure that there aren't too many and that the patients understand them, especially around diabetes. So we have our clinical pharmacist who volunteers here, Jamie Huff, and she brings students. So, I mean, it's a really good relationship that expands services and creates the next generation of leaders in the community who are going to leave here with a soft spot in their hearts for the great work free and charitable clinics do and for what they provide to the community. So we're very happy about being able to be part of that training. All right, moving back on out. A few things I didn't show you. We recently brought in Valley Health's partnering with us to do on-site phlebotomy services. We found it was really hard for some patients to travel the mile plus uphill because a lot of our patients might not have cars or reliable transportation to get those labs done. I mean, yes, we can get them done without any charge to the patients, but they were really struggling with just getting there. It was a barrier to care. So we worked with Valley Health, and Valley Health's come out and helping us do lab draws Mondays and Fridays, which is huge for our patients. So I brought you outside of pharmacy services. So again, we are open to the community. We just do not charge insurance at this time. our pharmacy staff is incredible. They know patient assistance programs inside and out. They are hooked up with all these other nonprofit organizations whose mission is to make sure that people who need help affording medications get the medications they need. So take diabetes medications, for example. Any idea about the average wholesale price for diabetes meds? Any guesses? Okay, think about the number in your head. All right, it's anywhere, the average wholesale price, so this is what CVS or Walgreens buys. It can range anywhere from $400 to $1,200 a unit. And a unit can get you through maybe a week or up to 2 months, depending on your medication needs. And for people who are living paycheck to paycheck, people who don't have $1,100 just sitting around in their pocket, that's impossible. And their health, you need your meds, you need treatment in order to live and to have a healthier life. So that's what our pharmacy does. That same diabetes medication, we can give it to them and ask only for a $5 donation. That's huge and life-saving for these patients who just need a little more help. So our pharmacy services are incredibly important. We actually had our pharmacy staff, they get to know our patients really well. They get to talk with them, help educate them about their meds. And so sometimes when our patients leave them because they get Medicare, they still call and they still ask for help. We had one patient whose medication her Medicare, she didn't pay the premiums on the Part D and it lapsed, and she went over to a local retail pharmacy and they said, well, that'll be $1,300, please. Your Medicare is not working. And she panicked. So she called over to the pharmacy staff and said, hey, I don't know what to do. I need my meds, but it's $1,300. Can you help me? Can you tell me what I need to do to get them? So they ran it through and they ordered the meds and they charged $18. I kid you not. So for somebody who needed some help, $18 for a $1,300 med. I mean, the work we do here, it's incredible, it's life-saving, and it just dramatically improves people's quality of life. So I'm very, very lucky to have such a strong and devoted staff. Both Brandy and Maureen here in pharmacy are just amazing and so patient-oriented. So I'm glad that we got a chance to tell you about the pharmacy services we offer here. All right, so we're gonna have to wrap this up. Our patients are ready to come in and be treated and get the quality care here at Sinclair Health Clinic. But before I do, I wanted to just touch on one important part of the services we offer. It's our community health worker program. So our patients have a lot of non-clinical factors that really influence their health, like homelessness or housing insecurity. They might have trouble with food security, job training. I mean, there's a lot of non-clinical aspects that have an incredible influence on people's health. So that's why we have a community health worker program. And what our community health workers do is that they will help connect our patients with the resources they need and try to make sure that those needs are met and that they're moving forward on those factors that otherwise inhibit health. Oh, and I forgot to mention about the artwork. It's not just pretty and soothing on the walls, but there's actually a lot of science and research behind having nature art on walls, and it does decrease stress hormones, and it actually does improve people's physical health. So just a quick thought on that. So I thank you so much for taking the time to come on this tour with me. I'm looking forward to all of your questions, and I'm glad you got this chance to see what we do here. It's really important work. We help over 1,000 people every year in our clinic, and we're looking forward to doing even more and serving our community better. So thanks for your help with that.